Started in just a minute. All right. Come on in, everyone. This is the CDOC All Members Meeting. My name is Shantae Davis Patterson, and I am the Program Director for California's Comprehensive Cancer Control Program. And we administer this coalition, the California Dialogue on Cancer, or CDOC. And we're so happy to have you with us for this meeting. We only do these meetings once a year. We do have a big meeting coming up later on in the year that you'll hear about where we'll have a chance to be face to face together. But for this meeting, we're just very glad to have everyone here. All right, so just a little bit of housekeeping. Everyone's been muted. If you want to ask any questions, you can just drop them in the chat box. We're monitoring the chat throughout the whole meeting. This will be recorded, so after the meeting, it'll be posted on our website and also on our listserv. We'll be sending it out on the listserv. All right, so our agenda today, we do have a packed agenda as usual because we do a lot of things. Today, we're going to hear from the chairs of our coalition. And then, just as we did for our last CDOC meeting, we're going to do a short little icebreaker just to kind of network with everyone in the meeting. Then we'll hear some updates from ACS as well as ACS CAN, the Cancer Action Network. Then we'll dive into comp cancer updates, and then we'll hear from all of our work groups, our liaisons, and then we'll quickly just go over all of the successes that we've had since our last all members meeting. And then we'll talk about all of the current activities that we're engaging in now. And then we'll have it open. So if anyone wants to ask any questions of us or leadership, you'll be free to do so at that time. And then, of course, we will ask you to fill out an evaluation because we always want to improve and get better on what we're doing. All right, so just a quick introduction because we do have some new members for the leadership of this coalition and who you'll hear from soon. Our chair is Dr. Sora Park Tanjasiri. Our co-chair is Dr. Allison Herman. Our vice chair is Bridget Freely. And then we have all of the comp cancer staff, which is myself. I've introduced myself. And then I have a wonderful team. Our coalition coordinator is Joyce Seha. And then our strategic alignment specialist, who also works with the California Cancer Registry, is Sheila Sinyo. And we also have two interns that are with us currently. We have Haley Shaw and Brittany Chin. So that's the leadership of the coalition and then the comp cancer team that helps move all of this forward. And right now I'm going to turn it over to Dr. Sora Park first, and then we'll hear from Dr. Allison Herman as well. Sora?
Thank you, Shantae, and thanks for everyone for being here. I'm actually going to ask Allison to go first, and then we're tag teaming this part. So Allison.
Thanks, Sarah. So thanks everyone for joining today. We are really thrilled to see so many partners from around the state coming together to support the important cancer control efforts that we are engaged in across California. Today's All Members meeting is a chance to reconnect, share our progress, and highlight the important work happening across the coalition. So we appreciate the expertise and lived experiences that each of you brings to CDOC. We want to recognize the incredible work of our members, work groups, and partners. Your collaboration continues to strengthen our statewide impact. We also want to take a moment to welcome our new CDOC members. We're grateful to have you with us, and we look forward to learning from your perspectives. Please participate actively today, ask questions, share updates, and take this chance to connect with others. These meetings are our way to really learn from and work together with our diverse membership. Now I'll pass to you, Sora.
Thank you. So it is my privilege and pleasure to take a few minutes in our meeting to actually do something we don't usually do, which is to recognize one of our own. And in this case is the very wonderfully collaborative Ms. Shantae Davis Patterson. So we are thrilled to share two updates about her and her wonderful work. First, Shantae has been honored with the Public Health Acknowledging My Efforts, or FAME Award. I love that acronym, for outstanding achievement in public health at the California Department of Public Health. The FAME Award stands for Public Health Acknowledging My Efforts, and it's an annual award at the Department of Public Health that honors individuals and teams who have gone above and beyond in advancing public health. Under Shantae's tireless leadership for over 2 decades, California has successfully developed and implemented multiple state cancer plans, engaged over 200 stakeholders across the state, expanded screening and vaccination initiatives, and improved survivorship care planning. Indeed, I think we've become a national leader in comprehensive cancer control under Shantae, under her leadership and that of her staff. So thus, this award is well-deserved recognition of her outstanding leadership, dedication, and impact. And if that weren't enough, in her spare time, Shantae has also recently been elected as the 2026-2027 chairperson-elect for the National Association of Chronic Disease Directors on the Cancer Council. This is a significant national level leadership role that reflects vision, expertise, and commitment to advancing chronic disease prevention and cancer control. So please, on behalf of all of us, please join us in welcoming Shantae on these, I'm not welcoming, congratulating Shantae on these remarkable achievements. We're so incredibly proud to have such a dedicated and forward-thinking leader, and lucky, really, to call you colleague and collaborated in all we do for cancer control in California.
Thank you so much.
Please, Shantae, go ahead.
No, I was just going to say thank you so much. And I feel like it's really the work of the coalition that moves everything forward. So thank you.
Wonderful. And now I'll turn it back to Allison to continue with the introduction.
Congratulations, Shantae. It's so well deserved. It's nice when people get honored for the great work they do. So happy to see it. So now I have the honor of announcing our new work group members and liaisons. So since we had our last meeting in October of last year, we welcomed several new members into the CDOC community, and we're excited to have them here with us. These new members have joined work groups, including colorectal cancer, survivorship, health access and disparities, and lung cancer screening work group, bringing fresh perspectives and energy. We're also pleased to welcome a new American Indian and Alaska Native liaison, helping us strengthen engagement and partnership with tribal communities across the state. So we're grateful to each of you for joining CDOC, and thank you for lending your expertise and being part of our growing coalition.
All right, so the time has come for us to do some breakout room introductions. Please don't jump off. This is going to be a really easy, fun activity. All we're asking everyone to do is to introduce yourself to the people who are in your room. So if you could just provide your name, your pronouns, or the organization that you work for, or if you're just here as a volunteer because you're interested in helping out in cancer control, that's fine. How long you've been a part of CDOC. And if there's time, you can share a project that you're working on. And you'll find that as we jump into these rooms, introduce ourselves, the time is going to go by just like that. We're only allotting, I think, 5 minutes or so. So just introduce yourself to whoever's in your room. You'll get a sense of who's on the call. All right. So all right. Like I said, I hope everyone got to meet someone that they haven't known or met before.
I got to know Allison Herman. Very interesting individual.
Oh. I guess we didn't see that one, Bill.
That's okay. We had Alex in our group, and neither of us had the chance to meet her before. So.
Oh, okay, awesome. All right. Okay. Great. Thank you all for participating in that activity. Now, I would like to welcome our Vice Chair, Bridget Freely from the American Cancer Society, to give us some ACS updates. Bridget.
Great. Thank you so much, everyone, for having me. That was a great breakout session. I'm also glad I accidentally kicked myself out of the whole meeting, so I'm glad clearly my tech savvy is not on today, but I am very excited to share a few updates from the American Cancer Society and also wrap up my last couple slides with some CDOC work group updates as well. So we can go to the next slide. Just to kick us off, I know that a lot of you probably have seen this already, but we release an annual Cancer Facts and Figures report. It's launched by our research team at the American Cancer Society, but I just wanted to highlight some key takeaways from our 2026 Cancer Facts and Figures. Some promising statistics: about 70% of people diagnosed with cancer now survive at least 5 years. So I definitely think it demonstrates our progress, but also demonstrates the need for probably more survivorship resources. And nearly 5 million lives have been saved due to declining cancer death rates since the early 90s, which I think is great. But while this progress is encouraging, we are still seeing increased rates for several common cancers, which I think really underscores the need for continued screening and prevention efforts. We can go to the next slide. And one way ACS is actually trying to help with this in terms of cancer screening is we've launched a new tool called ACS Cancer Risk 360. Some of you may have already seen this. It's a free online cancer risk assessment, and it takes about 5 to 10 minutes to complete. So individuals will go to this link, it's available on the web, complete a series of questions, and then receive personalized information on their recommendations for screening, prevention, lifestyle recommendations, genetic counseling considerations, all to really reduce their risk of cancer. We also have flyers to help promote this tool. Please take it yourself. Please take the assessment yourself. Share with any networks that might benefit from it. Share with your community members. We're really just trying to get this far out and wide in the community to help people learn more about their cancer risk. We can go to the next slide. Our medical content team created these great resource roundup documents for cancer screening with live links to many of our popular resources, which are organized by cancer screening type. We know ACS has a lot of resources, so hopefully this kind of gives a one-stop shop for all the different cancer screening resources. We do have cancer screening resources as a flyer for patients, and then one that's more geared towards health professionals as well. And this isn't all of our available resources, but I think it's a good sampling. And I've included links to both, so hopefully when the slides are distributed, you can access those. We also have dedicated sections of our website with information for health professionals and materials that would also be helpful for the general public. These materials are available in a variety of languages. They include things like one-pagers, webinar recordings, infographics, designated web pages, and more, just about topics ranging from cancer prevention and screening to treatment and survivorship. And I did want to shout out one resource that's really popular. It's our quick guide to ACS resources. It's a flyer that contains all of our most popular resources and programs with QR codes and live links so that everybody can access that information in one place. We can go to the next slide. Next, I want to highlight our 24/7 National Cancer Information Center. This is probably one of our most popular offerings. It offers phone, chat, and online support through cancer.org. So when a patient or caregiver contacts our NCIC, either through that number or our live chat on our website, trained cancer information specialists will provide support. They provide information on things such as diagnosis, treatment options, side effect management, insurance, patient services, and also connection to more local resources based on the callers, where the caller lives in their community. Go to the next slide. We also have ACS Cares, which stands for Community Access to Resources, Education, and Support. And this is a digital navigation app that supports people through their cancer journey. It really provides tailored information based on an individual's social needs, phase of care. It also includes access to our National Cancer Information Specialists and trained volunteers who can provide non-clinical support or maybe have gone through a similar diagnosis as them. And our team, I do want to note, has also made some enhancements to this app to make it even more customized to participants' needs. And we have flyers for this. You can download this app, the ACS Cares app, wherever you get your apps, whether that's Google Play, the App Store. And also, there is not a separate Spanish app to download. So for those with Spanish selected as their internal phone settings language, the ACS Care app will be displayed in Spanish upon downloading. You can go to the next slide. Our signature program, this is one of our signature programs, is Road to Recovery, and it provides free rides to and from cancer treatment appointments. The program now uses an easy-to-use app similar to Uber or Lyft, but individuals can also call our 800 number to schedule their rides if that's something they're more comfortable with. The service is active throughout much of California. We also need volunteer drivers, so if this is something that you'd be interested in, please let me know. We definitely, I can connect you with the team because the program really thrives on volunteers providing those rides. And one note I do want to make is that this service is only for rides to treatment. It's not for like screening related appointments. And we can go to the next slide. So the next couple of slides are just updates from a couple of our CDOC work groups that I think are pretty timely. And I know we'll have some further updates from other work groups in a bit. But we have a new resource from our CDOC lung cancer screening work group. This is our lung cancer screening rate data source report. So we know that lung cancer screening rates in California are low. We're not doing the best, but estimates vary widely across data sources, and it really makes it difficult to measure progress and really what the true picture of lung cancer in California is. So this report really breaks down these different data sources and provides a succinct explanation of which each data source can offer. I do want to note that it's not a ranking of the data sources, but just an overview of each that will hopefully be helpful. You can see it at the link here on the slide, and or also if you would like to scan the QR code. We can go to the next slide. I think this is our last one. Just our California HPV Vaccination Roundtable hosts an annual public awareness campaign, which is coming up on August 2nd through 8th. It's called California HPV Vaccine Week, and it's really our dedicated week to raise awareness of the HPV vaccine as cancer prevention. It's a really great way for health organizations, providers, survivors, really anyone who wants to be an advocate for HPV vaccination to get out the message about the importance of HPV vaccination for cancer prevention. We have a toolkit with messaging resources, social graphics, testimonial videos, and designated resources. So please take a look at our campaign. It's linked here. We are updating our campaign materials for 2026, and hopefully that will be ready in July, but our 2025 materials are still very relevant if you would like to start sharing information about HPV vaccination. And that is it, I believe. I did want to thank you so much, Joyce, for putting this together. This is a hot off the press update that we got from the American Cancer Society. There were some updates to American colorectal cancer screening guidelines from the American Cancer Society this morning. And that really is to include blood-based screening tests and some Cologuard tests, really just to expand screening access. As I mentioned, this was just released this morning, so my apologies, I'm still wrapping my head around it as well, but I do have the press release available. I can pop that in the chat. And we also are having a webinar on June 10th to kind of go over these updates in more detail. And I can also pop that registration link in the chat. And thank you so much, Joyce, for including that here. And that is all I had. But thank you so much, everyone, for the time. And Chantel, I'll pass it back to you.
Thank you so much, Bridget, for those updates. And now I want to turn it over to Ken Wilkerson from ACS CAN to give us some updates from ACS CAN. Ken?
Awesome. Thank you, Shantae. Congratulations to you. Want to give some quick high-level updates on where we are in the legislative process for a few of our priority bills. The first one being AB 957, which is our tobacco-free pharmacy bill. It remains one of ACS CAN's key tobacco prevention priorities. Just for a highlight, the bill would prohibit the sale of tobacco products in retail pharmacies and also reinforce pharmacies as healthcare settings. The bill is expected to be heard in the Senate Business and Professions Committee in June. We are awaiting a date. Our current focus for the bill right now is on committee engagement, member education, and addressing a few concerns that were addressed in last year's process. ACS CAN is also working with coalition partners in the author's office and public health stakeholders. We have also drafted a NASCAR letter or a letter in support that happy to share out if anyone would like to join or if their organizations would like to sign on to that, can share that out as well. Want to highlight also another bill, SB 1309, our Stop Lung Cancer Early Act. Thankfully, it has successfully moved out of the Senate and is now going to the Assembly. The bill would remove cost sharing for medically necessary follow-up services after an abnormal lung cancer screening. So very, very happy. Again, the bill cleared out of the Senate with strong momentum and no votes. Our current focus on that bill on SB 1309 is thanking advocates and volunteers and also preparing for the assembly process. It repeats the same process as the Senate, where we'll go to the Health Committee, appropriations, and then a floor vote. Lastly, want to highlight AB 2161, which is a bill we're not sponsoring but supporting very closely. It's the Medi-Cal work requirements and community engagement requirements bill authored by Assemblymember Bonta. AB 2161 also has passed out of the Assembly and will now move to the Senate. Just to refresh everyone's memory, the bill is intended to help reduce harm and protect Medi-Cal beneficiaries as California prepares for federal worker and community engagement requirements that were outlined in HR 1. ACS CAN's focus is also just ensuring that implementation does not create the unnecessary coverage losses for people with serious or complex health conditions, including cancer patients. And that's what this bill intends to do, just by emphasizing the message of coverage continuity, patient protections, and also reducing the administrative burden. Um, like I was saying earlier, the bill has passed out of the Assembly and is moving forward in the Senate process. We're continuing to engage with partners, the author's office, the committee. And yeah, that's all that I have for our primary bills. Also, did want to highlight before I missed that. Um, the governor's May revision budget that recently was announced. We're still analyzing it very, very closely to see what the impacts are to not only, cancer patients, but also the cancer registry as well, which is something we're also monitoring very closely in the reduction in Prop 99 revenue and all that other stuff. But more updates to come on that as we continue to assess. And here if you have any questions as well. Thank you.
Great. Thank you, Ken. I think before we move on, I'll see if there's any questions for Bridget or for Ken. If you have any questions, go ahead and just come off of mute, or you can drop it in the chat if you're more comfortable. Okay, I'm not seeing any here. All right, well, we can go ahead and move on. Thank you again, Bridget and Ken. All right, so now we're going to jump into some cancer updates. The first update is from a lung cancer screening action planning workshop that I attended with Raquel Arias, who, as you all know, is a member of this coalition um, uh, with the American Cancer Society. This workshop was an in-person action planning workshop. It was hosted by the GW Cancer Center, who is an official technical assistance provider for the National Comprehensive Cancer Control Program. We did have to apply to go to this workshop, and we were selected. So there were only 20 states selected in the nation, and California was one of them. This was held in Denver, Colorado back in April. And it's a part of a broader lung cancer screening community of practice. So in addition to this in-person meeting that we attended, we're also attending these community of practice sessions virtually. So we've already had two of them online. And really, the purpose of all of this is to strengthen our state's lung cancer screening using evidence-based strategies. So for us in California, we don't have an objective in our CDC action plan related to lung cancer screening. But as you know, we do have a very robust CDOC lung cancer screening work group. And so now, after this activity, we worked a lot on developing an objective for our action plan and looking at the various activities that we can engage in around lung cancer screening. And our next steps, which we're working on now, is to add a lung cancer screening objective to our actual CDC action plan. So there'll be more updates on our lung cancer screening work group, but just wanted to give that update on that very specific workshop. And it was an amazing workshop that provided a lot of great information, and we learned a lot from other comp cancer programs there at that training. So another update that I have that is that this is actually in our Comp Cancer Action Plan, our CDC Action Plan, is the California Health Plan Colorectal Cancer Screening Best Practice Exchange. And this is a learning collaborative that's supporting California health plans to improve colorectal cancer screening. And we will have a focus on Medi-Cal managed care plans for this particular collaborative. It is a collaboration, excuse me, between C4, the California Colorectal Cancer Coalition, the American Cancer Society, and CDOC. And the focus is on boosting HEDIS colorectal cancer measure performance with targeted tools, coaching, and technical assistance that will be available to the plans that join this collaborative. They will also be learning from each other, so there will be peer learning, and it will be through expert presentations. We have a lot of subject matter experts that's going to come and present through this webinar series. And they're going to present case studies. We'll have facilitated discussions, and this is all going to be across a 7-session webinar series, and it will kick off in August. And one thing that I didn't mention is that the Department of Healthcare Services in the Medi-Cal Quality Division will also be at our first session to help kick off this session. And as most of you know, that is a division that helps to manage those Medi-Cal managed care plans. So, and also, just as a part of this series, there will be all of the plans will have access to the latest colorectal cancer screening evidence and statewide experts, as I mentioned, and also resources. We're going to be putting together a very extensive resource package for these plans. So, a lot of work on this. We're gearing up, and again, we'll be starting in August. So we'll have more information for if any of you know of plans who would want to join this series. We're working on the promotion now. Also an update from our breast and cervical, or I always say that. It's our breast and colorectal cancer screening implementation project, or BCIP project. We are right now in the middle of cycle 4. Those projects began in January of 26. And you can see on your screen, you can't really see very closely, but we have 7 FQHCs that we're working with, and they're all listed here. You can see they are pretty much spread throughout the state. We do have one all the way up north this time, the Shasta Community Health Center. A couple in in Northern California, Central California, and then down in Southern California there. All right, and we are happy to introduce our CDOC Patient and Community Advisory Group. The Patient and Community Advisory Group, or PCAG, our members, this is just being formed now, and they will serve as external advisors who provide input to CDOC leadership on patient, survivor, and community perspectives, and advises on the development and implementation of our state cancer plan. And so we're really happy to add this group to our coalition as we continue to grow. We, again, want to make sure that we have that patient and community voice at the table. The application for this closed on the 20th. So hoping some of you applied for this, and we'll be announcing all of our PCAG representatives soon, and then also welcoming them at our face-to-face meeting in September.
All right, so today we have an opportunity to briefly hear from Comp Cancer's recipients of survivorship supplemental funding and learn about their project activities. Lucinda Bazile is the CEO at Cancer Support Community in the San Francisco Bay Area. Cancer Support Community provide free, comprehensive support programs, including counseling, support groups, nutrition, exercise, and patient education programs, as well as programs for teens and children. Please welcome Lucinda.
Thank you, Sheila. Thank you all for having me. So, as Sheila mentioned, we at Cancer Support Community San Francisco Bay Area provide free psychosocial and emotional support services for anyone impacted by cancer. And so, as I think Bridget mentioned, 70% of those with a cancer diagnosis are surviving at least 5 years. And we're able to provide survivorship services for those individuals. We've been doing this for more than 35 years. And thanks to our grant, we've been able to serve 186 survivors right now. And I think it's probably undercounted because they've self-selected survivor in their profile. They have attended over 633 programs or services within the organization. And so these services would include like our support groups, Life After Cancer support groups, which meet weekly. We have nutrition programs that focuses on cooking classes and demonstrations. And then we have our cancer transition workshops, which is coordinated with our national program. And then educational workshops, because we realize that social isolation is very detrimental, and being connected to community through survivorship is still important. So they participate in our workshops and classes, which include a lot of fun activities, including Tai Chi, yoga, and if anyone was able to attend our Hope Walk the 2 weeks ago, line dancing. So we're really appreciative to be able to provide the services based upon the grant that we've received from CDOC. And we do an annual survey where participants have indicated how our services has increased their quality of life, and that the services are really meaningful to them. As you can see, the programs have greatly helped me cope with the aftermath of my diagnosis and moving on with my life. So thank you so much for allowing us to briefly share where we are with our deliverables thus far. Thank you.
Thank you so much, Lucinda.
Mm-hmm.
So the Cancer Centers Collaborative was established under the 2021-2025 State Cancer Plan as a statewide network to connect NCI-designated and Commission on Cancer, or COC, cancer centers. This work supports the state cancer plan's emphasis on collaboration, data sharing, multidisciplinary care, community engagement, and reducing disparities. It also encourages cancer centers to collaborate and share best practices statewide. So the Cancer Centers Collaborative continues to convene quarterly with rotating cancer center hosts. The CDOC Cancer Surveillance Data Webinar Series provides virtual learning on cancer-related surveillance data sources. So CDOC partners with the California Cancer Registry, or CCR, and others to develop these series. And these webinars offer tools for accessing data for annual reports and work publications. Our upcoming June 17th session will introduce the California Behavioral Risk Factor Surveillance Systems, or BRFIS, the state's largest ongoing survey of adult health behaviors. The presentation will highlight newly released 2024 BRFIS data, including updated cancer screening variables, the prevalence of insurance coverage and insurance types among Californians, and how these factors differ across racial and ethnic groups. So please register using the link Joyce will be posting in the chat. Please also register for the upcoming CDOC evaluation webinar on Tuesday, June 2nd at 12 noon. The evaluation webinar provides an overview of key findings from the Comp Cancer Program's fiscal year 2024-2025 evaluation report findings. And we're explaining how Comp Cancer tracks progress, measure impacts, strengthens statewide cancer control efforts, and evaluate the 3 Ps, which is the program, the Comp Cancer Program, the plan, which is the state cancer plan, and the partnership, which is the CDOC coalition. So the registration link has also been dropped on the chat. And now I'll pass it over to Joyce for the next Comp Cancer update.
Thanks, Sheila. Hopefully everyone's able to hear me. First, I want to update you all on, if you haven't already heard, please save the date for our CDOC biennial member engagement meeting. Biennial, this is every 2 years, and we host it in person. It's going to be at the California Center for Healthy Communities, also known as the California Endowment. So please save the date for Monday, September 14th. Next, the CDOC orientation webinar was held on May of 2025, and we provided an opportunity for new and existing members to become more connected with the coalition by learning about essential information about CDOC structure, focus areas, and activities. This was a section in our monthly newsletter to remind our coalition of different levels of member engagement and to improve their understanding of various engagement options. So you can view the webinar recap on the CDOC website, and we'll also drop the link in the chat. And if you're still considering becoming a CDOC member or would like to invite new members, please view and share this information with a CDOC member. I'll be dropping that information. Next, we want to remind everyone that CDOC welcomes all members to spotlight their work or recognize individuals who have done work in cancer control. This is an opportunity to help spotlight your projects. So you can submit a form on the CDOC website. I'll be dropping the link to that in the chat as well. Lastly, CDOC launched a new initiative called the Partner in Focus. This just aims to spotlight a dedicated member of our coalition, just to foster collaboration throughout the CDOC community so that we can get to know each other a little bit better. As you know, we are working in our different work groups, but it would be nice to hear what our other folks in our coalition are working on. Next, I will pass it over back to Shantae for liaison and work group updates.
Thank you, Joyce. Okay, one of our liaisons of our coalition is the California HPV Vaccination Roundtable. The roundtable is its own separate coalition, so we kind of call it our sister coalition because it was co-founded by the American Cancer Society and CDOC. So I'll just give a couple of updates, and this is not a comprehensive update of the roundtable, but just a few items here. So the first one is that we successfully held our in-person 2025 California HPV Vaccination Roundtable annual meeting last December in Los Angeles. And you'll see that first picture is all the folks that attended there. We had our keynote from Dr. Peter Szilagyi, and those who work in the field know that he is very well respected, and he gave us a lot of updates because, as you know, there's a lot of updates happening in the immunization space. So he gave us national and state HPV immunization landscape updates. Also, the meeting, we had an asset mapping exercise and an excellent panel showcasing statewide efforts to address disparities. And that asset mapping really helped us to identify where all of our current resources are, and we're still kind of working on next steps from that. And also, just a few weeks ago, at the end of April, we held a productive steering committee meeting, and you'll see all the folks in our steering committee there. And we really just talked about various agenda items and clarified next steps for our priority projects that we're working on in the coalition. So one of the things that Comp Cancer helps coordinate is the California HPV Vaccination Learning Collaborative. It's a quarterly lunch series, and it's where folks can come and learn best practices on how to increase HPV vaccination. We hold these, like I said, quarterly. Our next, we just had one on April 15th, and our next one is in July. And these are recorded. So if you go to the California HPV Vaccination Roundtable website, well, you'll see here at the bottom, you can access the recordings of previous sessions of the Learning Collaborative. Also, we conduct the announcement approach training, which is an evidence-based training to help increase HPV vaccination. It is endorsed by the National Cancer Institute, and participants can learn strategies for recommending the HPV vaccination to promote vaccine acceptance and save clinical time. They can also be up to date on the latest in HPV vaccine research. These are completely free and they're held virtually, and we will be having CME credits for these in the coming weeks. So just contact us if you're interested, or if you know a health system or anyone who's interested in those. We also did a webinar series titled Boost HPV Vaccination Quality Improvement Webinar Series for California clinicians and staff. It's a three-part series. The first series included trusted messengers, communication strategies to increase HPV vaccination, then the announcement approach, what I just described. And then next, on June 10th is the next one, and we'll have or at least the focus or the topic is health systems. And we'll have someone from Rady Children's Hospital highlighting the systems approach using real world quality improvement examples, use of adolescent immunization metrics to drive performance, and also looking at care functionalities, the California immunization registry functionalities supporting assessment and reminder and recall. So that's on June 10th. All right. And now, well, before I pass it over to Bill, I just want to ask if anyone has any questions so far. All right. Take it away, Bill. Bill, are you here? Okay, let's go to the next update and then we'll come back to Bill. Anna, are you ready?
Yes, ma'am. Thank you.
Okay.
Can you hear me okay?
Yes, we can hear you.
Oh, great, great. Do you have my slide? There we go. Okay, so for those of you who have not met me, my name is Anna Knight. I'm a family nurse practitioner by trade. I work for the Indian Health Service for the California area office out of Sacramento, although I am in Southern California where my physical office is. And I have been a member of CDOC for just about coming up on, I guess, 2 years now. And so big thanks to the group for their collaboration and support. Thanks to folks like Shantae and others. We have been very busy since I've come into this role. Right now, currently, we're in the midst of a multi-year collaboration with CMS, who contracted an American Indian Alaska Native quality improvement projects throughout the state. So I think we have a total of 3 or 4 contracted staff on behalf of CMS. And so I'm collaborating with them as much as possible so that we can have as much impact as possible. We have ongoing cancer navigation support. We had a call this morning with Raquel and Demi presenting for me this morning. So we continue to build out and support our navigators from our training last year. We continue to do ongoing tobacco prevention cessation training. We utilize the Catch My Breath Youth Vape Prevention And Indian Health Service has a contract with the University of Arizona Healthcare Partnership for the brief basic tobacco intervention skills training. So that was the last group on the right that we trained at Indian Health Council. We had 2 groups, a total of 20 staff that we trained in BTIS. Very excited. Recently received some funding to do a population health colorectal cancer screening initiative. So I am working diligently on putting a 2-day workshop together for programs throughout the state to really implement the Access program that Samir worked on, and have included all of that evidence in my table of evidence. So I'm really excited to see if we can make some headways to add population health as a component to what our programs are already doing when it comes to smart strategies. And then we just have ongoing collaborations with all the comprehensive cancer centers. So I'm so grateful to UC San Diego, pictured down in the middle with Dr. Gerald Tolbert from their JEDI program. We collaborated with them on the mobile mammography unit. So now that's in place regularly for 2 of our programs in San Diego County. And then, of course, collaborations with C4. You can see in the bottom left, Indian Health Council rented their 35-foot colon for their March colorectal cancer awareness event. So lots of good things happening thanks to collaborations and everybody here who supports me and the work I do, because I am an army of 1, but feel like 100 with everybody's support. So thank you to CDOC and all the other partners on the call.
Thank you. Thank you, Anna. Now we're going to move back to Bill. I see you there, Bill.
Yeah, sorry. As most people know, the Obesity, Physical Activity, and Nutrition Work Group has recommended that we limit processed foods, that we eat lots of minimally processed Mother Nature foods, and we exercise. But next slide, I encountered a nice review article indicating how important the gut microbiota is for influencing both cancer prevention and cancer treatment. And so to complicate our prescription, we now recommend that people eat the rainbow. They need to eat a diversity of fiber-rich, polyphenol-rich foods. They need to have a diversity of exercises, so not just aerobic exercise, but strength training as well, and stretching. And then finally, stress management is important. And as this circle illustrates, it's a fairly complex array of mediators that take the food that's then biotransformed by the gut microbes and then produces a variety of metabolites, most of which are protective, but some of which are unhelpful. And so I encourage the attendees here to go to this article that's listed at the bottom for a lot more detail than I have time to provide today. Bye. Thanks.
Awesome. Thank you so much, Bill. Now we're going to go to the update on the state cancer plan. Can you go back up to my slides, Joyce, please? All right. Yes, so updates on the state cancer plan. So the first update we have is we do have a dashboard for our state cancer plan. And to be clear, this dashboard is for the 2021-2025 state cancer plan because we do not have data for 2025 as of yet. So we're still measuring progress for how we're doing on this plan. And so we have 23 data right now that's up that this dashboard is updated to. And we will be releasing this in the coming weeks. So just FYI, our amazing intern Brittany Chin has been working on this, and you'll be able to go to this dashboard to see about progress that on the 21-25 cancer plan. So if you go to the next slide here, and you'll see these are all of our state cancer plans. Our current cancer plan is still in the CDPH approval process, but we do have with us today someone from CDPH who is my boss, Mark Damison. He is the lead for the California Cancer Registry and the branch chief for the Chronic Disease Surveillance and Research branch under the California Department of Public Health. And I want to welcome Mark on to provide an update on the state cancer plan.
Thank you, Shantae, and thanks to everybody for all the things that I've been learning today, and all the really exciting things that are happening both at a program, the sort of implementation work that goes on, as well as the policy that ACS was talking about. Just really, really thrilled with all the things that are happening. I want to give, as Shantae said, a brief update on process regarding the 26 to 2035 cancer plan. The plan has gone through. First I want to I'll probably end with this as well, but I want to congratulate and thank all the teams and the individuals who wrote to the plan itself and went through multiple drafts and multiple, a lot of work just to get to the content itself with the achievable and measurable factors that are there, and keeping it with one structure and with a voice which really I think represents the group very well. We know that this was a lot of work, that it's something that you should be very proud of. And at this point, as I say, I'm giving a brief update on where it stands in that review process, so it can be released to the public. It's gone through a number of layers within the department already. What's been happening is it's actually gone higher than any previous plan has. What's happening now is it's getting some exposure and some review at the level of one of our sister departments. I think you're aware we are with the Department of Public Health. Some of the content in the plan speaks to programs within the Department of Healthcare Services. So we're getting some input from that. In fact, I just gave a update. I sent a reminder to Department of Healthcare Services yesterday on that. And then there's also a review at agency level, which is over all the departments for health and human services. So essentially that is where it stands. We're very actively working to respond to any questions that come up. I'm working with my chain of command to the best we can try to move those remaining reviews forward. As you can imagine from what's been happening federally and what's happening just around statewide between the budget current budget year as well as things that are happening federally, there's so many distractions that people have. What I do want to say, kind of coming back to what I said at the beginning, your effort is incredibly appreciated. As the different reviews are happening, people are impressed or they're extremely enthusiastic about the product itself. It's just a matter right at this point of getting those final sign-offs so that we can cross the finish line and get it out. So that's really the update. I don't know if we're at a point now where we can stop to see if there's any questions. Just speaking, I'm just looking at the slides that Sheila put together. I think we've touched on these things. There are some wording questions that came up as we went to department around the word advocacy. Just so you know, because of where the department sits under the executive branch, we really can't speak to advocacy. So what we've done is to preserve, this is a policy, systems, and environment program. So being able to encourage appropriate and positive changes that'll help the policy, systems, and environment structure to prevent and control cancer. We want to keep that. We've had to have a couple wording changes, and you'll see that when it finally comes out. But as I say, we've tried to keep the spirit of what we're doing. That last bullet is what I already mentioned. So, any questions or comments at this point? I really appreciate, again, all the work that's gone into this. That's been appreciated at multiple levels now that it never was really before. So I see a positive to this process, despite the delay, which is obviously, not what we would have wanted. But I wanted to see if there's any comments that I might help me at this point, or any questions based on what I've said.
Mark, I do have a question. Is there
Please.
any anticipation that there will be a pullback in the LGBTQ and or health equity language due to where we are federally?
I have not seen that. Of course, within the state environment, which is where the review is at, and the review that needs to happen, the state remains, has really remains committed to the extent that the federal executive orders apply. Respecting those executive orders, the state remains committed to the vision of equity, diversity, inclusion. So I do want to say, and I think what you're bringing up is that yes, there's at the federal level, there have been the executive orders we've all seen around those that language, I guess, that sort of communication. We do need to respect those to the degree that they're applying to the work we're doing. I haven't seen anything within the state's a review that are going to have that an impact beyond what we might already get directly from the feds, which we've discussed before. Anything else?
I don't see any other questions in the chat. Any other
Okay.
questions for Mark? All right. Mark, I want to thank you for jumping in and providing this update for us.
So I thank you, and I just did see the question. So thanks to Shannon. But yeah, I just want to end with, I appreciate everything that's going on and all the effort that you're putting in. It is highly appreciated and highly respected at the department level and even above.
Thank you again, Mark. One last update related to the state cancer plan. We are still working on these implementation guides. These implementation guides will accompany the state cancer plan, and they are made for particular audiences that will implement the cancer plan. So there will be more on this, on the implementation guides, and we'll be working to get those approved as well, so we can release them when the cancer plan is approved. All right, so now we want to go back to our liaison and work group updates. And next we have the California Colorectal Cancer Coalition liaison and our colorectal cancer work group. So I think I'll invite Mary Beth first to give any updates here. I think we have a WC4 update.
Hey, Shantae, Stoney's going to handle this.
Okay.
Yeah.
Thank you, Mary Beth.
Y'all told us it'd just be one speaker, so Mary Beth was let me
My
do it.
apologies. That's
No,
my fault. Sorry. Go ahead, Stony.
the fourth annual Western Colorectal Cancer Consortium Conference is going to be on October 1st through 3rd, and it's going to be there in UC Davis Conference Center. I put in the chat the website. It's now presently the website's housed under the C4 website. So it's ca:/WC4/, and that takes you right to it. And registration is open. It's going to be great. We're going to talk all aspects of colorectal cancer screening and all aspects of colorectal cancer care and what we need to do about early onset colorectal cancer. And so it should be a great fourth event. Next slide, please. So I'm Shantae and I and Fight Colorectal Cancer and the chronic disease directors back in 2021 got CMS to add colorectal cancer screening to their quality measures. And so we've been measuring it since 2022, and I'll give you a little update through 2024. Next slide. And I'm comparing on this slide the Medi-Cal screening rate in 2022, 2023, and 2024 to the commercial screening rates that are on the report card, the ca.gov report card. And as you can see, we're below the commercial screening rate, so we've got a ways to go, but we've made incredible progress, mainly through some work CDOC and C4 and ACS have been doing with California Department of Healthcare Services, and also I'm sure the Hawthorne effect because we've been measuring it. So we've gotten a 7-point increase from 37% to 44%. Next slide. But of interest, these are the big health plans, and almost 50% of Medi-Cal managed care are in these big health plans, and they're LA Cares. And the problem is LA Cares, and unfortunately the slide moved a little bit, is still screening at 38.5. So anyone that has anything to do with LA Cares, tell them we need to work with them to get their screening rate up. HealthNet also is still low at 38. But Inland Empire is a winner. They're at 50%, and Kaiser has taken a big position in Medi-Cal with now 1.1 statewide members, and they're at 78.7%. And as William McCarthy notes, that's an increase from they were started at around 70%, so this is quite good. And Medi-Cal, as you can see there, has moved up to 44.22%. Next slide. So here are the 5 Medi-Cal health plans with the highest screening rates. Kaiser's 78, but Health Plan of San Mateo, Contra Costa Health Plan, Santa Clara, but the real winner, I think, is Inland Empire, who have multiple providers and multiple counties that they work in, but they're up to 50%. Next slide. And here's some folks we need to work with, and through this collaborative that Shantae went on earlier, we will be working with these groups. And they're only screening about 1 in 3 of their patients for colorectal cancer. Next slide. So we are doing well if you compare our CMS rates, and the CMS measures colorectal cancer screening, oddly enough, gives you 2 measurements, the 45 to 49-year-olds, and nationally it's at 22.9%. And in California, we're at 24%. And the 50 to 65-year-olds, and nationally it was 37%, and we're at in 2024 at 40.6. You may note that there's different ranges. This is what was reported to CMS, and the health plan data is on next slide, please, it'll explain it. Well, it will. That'll be the following slide. So the summary is the Medi-Cal contracts with an external quality review organization, and that's where I get the figures I gave you on most of those slides. It's a big quality audit of all of the health plans for all their quality measures. Go back one slide, please. So we exceed the national Medicaid colorectal cancer screening rates. They've increased 37 to 44% in just 2 years. But we're still 15% below the commercially insured screening rates. And we need to work with these health plans that are only screening about 1 in 3 of their members. And the best thing is in 2026, Medi-Cal health plans will be required to have their colorectal cancer screening rate above the 50 percentile of the Medi-Cal HEDIS national average to avoid the California Department of Healthcare sanctions program designed to improve health plans' poor performance on a quality measure. And this can be just action plans, fines, or actually termination where you can't take care of Medi-Cal. Next slide. And you'll have access to these. Well, go back one. This is the reference, the website of the external quality review organization's report. It gave all that data that I gave you in 23 and 24. Thank you very much. Any questions? That's good. It's good news.
Yeah, I don't see any questions here.
There's one more slide, but it's actually for our report. You go one more slide, or maybe you took it out. No, one more. It was the quality program that Shantae went through. Because of these low rates, we're doing this big effort with 7 webinars over the next year and a half to increase the health plan screening rates. That was the final slide in our group.
Yes.
Thank you.
Thank you, Stony. All right. And for our health access and disparities work group, I will turn it over to Shannon.
Hello, everyone. For anyone who's new here and wasn't in my breakout group, I am Shannon Kozlovich, she, her, hers pronouns. I've been on our executive committee since 2020, and I've been one of the co-chairs of our health access and disparities work group since it relaunched in 2021. And I'm really excited to give y'all an update on where we're at with everything. We have been working on an underreported data project since 2021 when we came together and we were like, hey, we've got a lot of data in the state that's not collected. We first started focusing on sexual orientation and gender as collected separate from sex in medical records. We did a cancer center survey that was collected in 2020. And we're discussing relaunching that survey. That's a little bit on hold because of a lot of the changes at the federal level for where this is going. So in 2024, we completed a patient survey where we asked 300 patients at cancer centers in California, hey, how do you feel when you're asked about SOGI data? And we're in the process of putting that into a manuscript or report. We are hoping to launch a provider or clinician survey, hopefully later this year, with a couple of pilot sites. And we just completed our community survey in 2025. And the report for that was actually just released in the last couple of months. So if anyone wants to take a look at it, I put it in the chat for you. We're really excited about what came out of the community survey, what we did with that survey, which I believe is on the next slide, was we collaborated with the California LGBTQ Health and Human Services Network to put out a survey for LGBTQ plus folks in California. And basically, we asked folks, how do you feel most affirmed when you are presented with questions about your sexual orientation and your gender identity in a healthcare setting? And we got responses. We ended up having to delay the launch of our survey by a couple of months because we were planning on launching at the end of January 2025, which was an incredibly devastating time because of the executive orders that were released for the queer community across the entire United States, and definitely just as bad for us here in California to hear about all of the pullbacks. So when we did finally launch it near the end of March, we ended up keeping it open until August, and we collected about 300 survey responses that were valid and able to be in the analysis. And from there, we have a report. There was a webinar that was launched, and the funding mechanism that the California Health and Human Services Network had for this was not reauthorized by the state of California. And so they are no longer taking this forward, but I am offering any institution that wants to have a training built out of this or workshops that are built out of this for your institution, please reach out to me and let me know. I'm happy to make sure that this work continues to be in this sphere and continues to be available as much as I can. Next slide, please. Or is that everything for us? Yes, perfect. I will hand it off to, or I'll hand it back to Shantae. Thanks, y'all.
Thank you so much, Shannon. And for our survivorship work group, I don't think either of our leads are here, so I'm going to turn it over to Sheila for the update.
Thanks, Shantae. So the psychosocial support project is still currently being implemented by the cancer support community. We've heard some of their projects from Lucinda earlier. And then the other project is the caregiver support project. It brings new support to cancer caregivers across California through a partnership with Triage Cancer. So the goal of the project is to provide caregiver education, practical tools, and individualized navigation services statewide. And available resources include free webinars, practical guides, bright boxes, and one-on-one legal and financial navigation for caregivers. And then the other project is the CDOC CHW Guidance Initiative. It convenes a multi-sector advisory committee, including the cancer centers. Next slide, please. CHW-focused CBOs, payers, ACS, Indian Health Services, CHW training developers such as the ACS Lion and the GW Cancer, and other partners to inform and refine the CHW guidance. So the core goal of this initiative is strengthening partnerships to expand training alignment and implementation of CHW cancer-related programming statewide. So the guidance focuses on 3 priority areas such as the cancer prevention and screening, early detection, community research and clinical trial engagement, cancer survivorship, and supportive care. So once the advisory committee completes their review, we will move into a more formal cancer center sign-on process. And after the sign-on, the CHW guidance document will be submitted for departmental approval. And upon approval, CDOC will share the final guidance with HCI, or Healthcare Access and Information, and DHCS for statewide posting and dissemination. We're also exploring potential partnerships with health systems that employ CHWs to support future adoption of the guidance within their organization. And I'll pass it back to Shantae.
All right. So now we are moving on to our successes. And I want to, before I move on, I see Anna has a question. Go ahead, Anna, please.
Thanks. Sorry, I did have one quick question. Is the group's plan also to address working with Medi-Cal on G codes for the principal illness navigation for reimbursement?
Right now, we haven't gotten that far yet, and we're just putting this guidance document together. And we do plan to continue working with this committee that we have on next steps. So I'm not sure if that will be included, but right now it's just the document that we're working on.
Awesome. Okay, I appreciate it. Yeah, just from the tribal program standpoint, a lot of our tribal programs don't currently, well, I'll just say I only have 1 out of 60 tribal programs that do CHW reimbursement.
Okay.
Because it's not worth, quote unquote, their time to bill. It costs more money to go through the billing process to get the reimbursement than the reimbursement. And the principal illness navigation G codes reimburse at significantly higher rates and are expanded to include not just CHW staff, but RN staff as well. And they reimburse, I think it's $70-ish for a 60-minute period in a 30 days. So, and I know a lot of programs specifically are trying to figure out what to do because currently only Medicare Part B reimburses. That's it. We don't have any G codes with Medi-Cal accessible at all right now.
Okay. Thank you for that information. That's something that I can bring to the committee and we can discuss if we can address that and how we can incorporate that into our effort. So thank you so much.
Thank you.
All right. Now I want to bring on Allison just to go over some of our successes here.
All right. So, I mean, we've heard a lot in this meeting up until now about the year's accomplishments, many details. So these slides are going to provide a summary to highlight further the breadth of work that's happening across CDOC. So all of these achievements, along with the full descriptions, numbers, project details, are posted on the CDOC website. So we encourage you to take a look after the meeting or at your earliest convenience. As you review the full list online, you will see progress across cancer surveillance, state cancer plan activities, lung cancer screening initiatives, HPV vaccination efforts, partner engagement, and more. And this work really reflects the collaboration across our coalition. So thank you again to everyone who contributed to these achievements. Please visit the website to explore the full set of updates for the year 2024 to 2025. And Joyce is going to drop the link, I think, to the CDOC successes and activities, so you can go directly to that location on the website. So thank you, Joyce, for doing that, and thanks to everyone for all of your amazing work.
All right. And then our activities for 25-26 for this fiscal year here. And this is something that we've gone through most of these activities, the CRC Learning Collaborative. We talked about the state cancer plan, also working with the California Cancer Registry on surveillance program objectives, like our surveillance data webinars. We're coordinating our meetings with you all here, coordinating convening meetings for the Cancer Centers Collaborative that we talked about, and then our survivorship projects. Also, continuing collaboration on the underreported data project, also the HPV vaccination roundtable. And then also working with our CDOC evaluation team for evaluation. And then, as I mentioned earlier in the webinar, we're introducing our new patient and community advisory group. All right, so we really don't have a lot of time left. It was only a few minutes left here, but we have 3 minutes. So if anyone has anything that they want to raise, any questions or anything like that, please, this is your time. Please come off of mute or raise your hand. All right, I'm not seeing
No, Selena.
here. Oh,
Selena.
Selena, please.
Yes. Hi. Hi, that's great.
Hello.
Really. Thanks so much for having me on the call. It's really wonderful hearing from all the different groups. Yeah, I just had a quick question. I'm new to the group, so I don't know a lot of background history over the years, but I was just curious about like a statewide initiative to I guess across hospitals to check for colorectal cancer in terms of like screening, like for hereditary cancers. Like as soon as someone has colorectal cancer, is there a statewide initiative to check for hereditary type cancers? And then, especially if they're young too,
Yeah.
if to like
Yeah,
trigger.
we're thinking of introducing a bill to make it mandatory testing for the mismatch repair genes and all colon cancers that are removed in the state. That's not being done now. And we think that's a bill that we could get through. So we're working on getting that bill ready. We may not introduce it this year, but we may wait till next year because hopefully better fiscal situation next year.
Got it. Thank you so much for that insight.
And I just want to also just be clear that when he says we, he's talking about the California Colorectal Cancer Coalition, or
Yeah,
Got it.
because CDOC
Yeah.
can't do that. Yeah.
Yes.
Right. Okay. Got it. Yes. Very
Which is a
specific.
liaison of CDOC. But yes, they do all that great work there.
Okay. Awesome. Thanks.
Thank you, Selena. All right. Okay, well, it looks like we're coming up to the end. Joyce, I think we have a couple more slides here for evaluation. Please, if you can, take a minute and fill out our evaluation for us. There's the link in the chat there, or you could just scan the QR code with your phone and get involved with us. If you're not already signed up, I hope you are. You can sign up on our website, cdoconline.net, or send us an email to cdocshare@gmail.com. I want to thank everybody for joining this meeting and for all of your participation. And please look out for our registration link for the meeting in September. We hope to see all of you in person. It's always great to connect in person. We are planning to have some scholarships available, so just keep checking the listserv. We'll be sending out more information, and have a great rest of your day. Thank you, everyone.